MCQ based exam. It tests your basic medical knowledge, the subjects that you have learned in the first 4 years of your MBBS. Then is the USMLE Step 2 CK exam. It's a written MCQ based exam, and it tests your clinical subject knowledge, mostly the subjects which you have learned in the last year or the final year of MBBS exam. Then is the USMLE Step 2 CS exam, or the clinical skills exam. It's not purely a written exam. It tests your patient examination clinical skills. It means to say that you have to examine the patients, take history from them, do the physical examination, and write the patient notes, and you are evaluated on how well you examine the patients. And then is USMLE Step 3. It's an optional exam. It's a written MCQ based exam. I would say it's an advanced form of USMLE Step 2 CK, or the clinical knowledge exam. Now, what should be the timeline, or how should you plan on doing the USMLE steps? How much time you should devote to each step? Now, you should finish all your USMLE exams before September 1st of the year you want to apply for the residency. Now, the process of applying for the residency, going for the interviews, and the final selection, this whole process is known as the match process. Now, what should be the average preparation time for USMLE exams? You should spend at least 7 to 9 months on step 1. You should not spend less than 7 months. It means that you are devoting less time to the preparation of step 1. And if you go above 9 months, then you are probably delaying this process unnecessarily. For step 2 CK, you should spend at least 5 to 7 months. Again, not less, not more. For USMLE Step 2 CS, 1 month preparation is quite adequate. Step 3, which I would again say is optional, you should devote 1.5 months for its preparation, because it's an advanced form of Step 2 CK, so your CK knowledge, or the clinical knowledge of your Step 2 CK exams, helps you a lot in USMLE Step 3. Now, USMLE Step 1. It's a written MCQ based exams. Now, there are 7 MCQ blocks, but they keep on changing how many MCQs are in each block. It used to be 50 MCQs, but now it's 46 or probably 48 MCQs in one block. You have to finish each block in 1 hour period, and there's a 1 hour break in the whole exam, so it's a total 8 hour duration exam. Now, you can divide your 1 hour break time into small pieces like 5 minutes, 10 minutes, whatever you like. Now, the USMLE Step 1 exam can be taken outside the US. Like in Pakistan, it can be taken. In Pakistan, there are 3 centers. One is in Lahore, the other one is in Islamabad, and the third one is in Karachi. Now, USMLE Step 1 exam tests your basic clinical subjects. Now, there are 7 subjects tested on USMLE Step 1. These are: number 1, anatomy; number 2, physiology; number 3, biochemistry and genetics; number 4, microbiology and immunology; 5 is pathology; number 6 is behavioral sciences; and number 7 is pharmacology. So these 7 subjects are tested on your USMLE Step 1 exams. Now, USMLE Step 2 CK exam, or the clinical knowledge exam. It's a written MCQ based exams, just like the USMLE Step 1, but it has got 8 MCQ blocks. Again, the number of MCQs in each block has been changing. It used to be 50, but now it's at 48 or 46. Again, you get 1 hour for each block and a 1 hour of break time, so it's a total 9 hour duration exam. It can be taken outside the US, like the USMLE Step 1. and it tests your clinical subjects. The subjects tested on USMLE Step 2 CK or the clinical knowledge exams are, there are 5 subjects. Number 1 medicine, number 2 pediatrics, number 3 gynecology and obstetrics, number 4 surgery, number 5 psychiatry. Psychiatry tested on USMLE Step 2 CK is very similar to behavioral sciences that you prepared during your USMLE Step 1. The USMLE Step 2 CS exam, it's a clinical skills exam. CS stands for clinical skills. It's not purely a written exam. You have to do a bit of writing or a bit of typing, but it's not an MCQ based exam. It can only be taken in USA. It cannot be taken outside the USA, like it cannot be taken here in Pakistan. Now, here in this exam you get 12 standardized patients. These are not actual patients, these are actually actors who have been trained to become patients. Now the USMLE Step 2 CS is evaluated on 3 aspects. Number 1 is English language proficiency. How good is your English? Can you communicate with the patient in a good English language? Number 2, your communication skills. How well you develop rapport with your patient. How good are your communication skills? Number 3 is data gathering, which includes 2 things. Number 1 is your history taking skills and the physical examination skills. Number 2 is the patient's note. At the end of each standardized patient encounter, you have to go out of the room, write or type your patient's notes, and these patient notes are then evaluated by physician. Then is the USMLE Step 3. Again, I said it's an optional exam.